This is the most important point about the cost of healthcare reform, and that is that if the government takes over, which make no mistake about it, that's what Obamacare and all this reform, in quotes, mind you, scare quotes, those are scare quotes. That's what reform is about. It's about government controlling your healthcare. And we're going to lose a lot of things if government does that. We might gain some things. It's not, well, it depends on your perspective. We might gain some. But for starters, I was listening to the previous talks and it was great because I can sort of stand up here and say, it's almost like an Alcoholics Anonymous group. Since I got my high deductible health insurance policy, and I have a deductible that is scary, okay, but it's affordable, it's mine, I'm a freelancer, I have to buy it. I've saved, this year alone, I have reduced U.S. healthcare spending by more than $1,000. Okay. In one case, it was a kid with a sprained ankle. The orthopod practice, who are very nice people but are clueless about cash-paying patients, just said, well, their insurance will pay for an MRI. I'm like, it's a sprained ankle. And they were very kind. They searched around for the cheapest MRI, but it was $400. I said, we can do without this for another few weeks, and the ankle got better. Another case, I was really weirdly sick in November. You know, my glands were like the size of softballs. I felt awful. They tested me for strep, no, etc. You know, I'm older than dirt. And he's looking at me and it doesn't get better and he's thinking head cancer or something. So we want to do an MRI of your head or a CAT scan of your head. I'm like, big deductible. I'm paying cash. Can we wait a couple of weeks? And is there anything possible that it could be? Well, it might be mono. But no, it's not mono. You're too old. It was mono. Okay, but while he was doing the blood workup for the cancer, he figured he might as well add an Epstein-Barr test. So from personal experience, I'm the only person my age in the US that's ever had mono, probably. Too much time spent in libraries in the backwoods. Not enough time getting infectious diseases when you're young. And the symptoms aren't as bad. Okay. I, from personal experience, can tell you that when you are paying out of pocket, you pay attention at the initial stage, which is what kind of care do I need? Now, if somebody's in a car crash, you know, or somebody needs a vaccine or something, our household is there, cash or no cash. We don't skimp on necessary care, but we tend to change the way we buy care. So what's going to happen if the government takes over? Well, I would say we're going to lose four major things. We're going to lose cost reduction because nobody is going to care what it costs. All right? We're going to lose innovation because I won't be able to talk to my physician about different treatment plans. No physician is going to have an incentive to design another treatment plan. And we're going to lose good care. We've already talked enough of the breast care, the cancer screening mammogram recommendations were absurd. I read the papers for the John Goodman blog, and one of the things they said in there was, well, if you want to save lives, you should screen the under 40s. But if you want to reduce costs, you shouldn't. I mean, that's explicitly there in one of the papers. Now, ask yourself, if it's the government and they're here to help you, how does the government view sick people? Sick people are a cost. And in every single government healthcare system in the world, they don't treat sick people very well. Who do they treat? They treat the median voter well. Sick people, let them die, it's cheaper. And that's what the accountants think. And that's a very straightforward way to put it, and that's the way it works. The other thing we will not have under healthcare is good financial protection. And the reason, as was brought up earlier, you're talking about the individual mandate earlier. All of the government health plan reform proposals always have something that says, you've got to buy insurance. As soon as they say you've got to buy insurance, they get to tell you what kind of insurance you've got to buy. And they always want you to buy very expensive insurance. My deductible is illegal in Massachusetts, and so is Justin's. Yeah. Because they decided the maximum I should be able to have it for a deductible for a family is $4,000, because any more than that I couldn't handle. It's none of their business. The reason an individual mandate is disastrous is A, they control health insurance, and B, it acts as an unlimited tax, because they are basically telling you that you have to buy a product that they get to define. And they're selling it by saying, well, we have all these people getting all this uncompensated care, it's expensive, think how much you'd save. The Lewin Group for the Blue Ribbon Commission here in Colorado calculated about how much it was costing to pay for care for the uninsured. The uncompensated care for the uninsured in Colorado adds a few $100s a year to my health insurance premiums. Now, I'm not stupid, and I can do the math, and I know that if we get health care reform, it's going to cost me a lot more than a couple of $100 a year. And furthermore, I'm willing to pay that $200 a year, this is for a family plan, in order to preserve my liberty to buy the kind of health care that I need. So don't buy those kinds of arguments about cost shifting. They're false. Okay? The uninsured pay for about a third of their own care as it is. So how do you think about these costs? One of the best ways to think about the cost is John Goodman. John Goodman has been describing this healthcare reform stuff very well. He says it's a syllogism, and there's a major premise. And the major premise is that the United States spends twice as much per person on healthcare as Canada and most European countries and has worse outcomes. Everybody in Washington believes this. Their minor premise is we spend twice as much and we don't get as much. We get poorer outcomes. And then the big, little cartoonist light bulb comes on over their heads and they say, oh, we should tax the rich and then spend even more on healthcare. That will fix it. Okay? So that's what's going on with healthcare reform in DC. And what I am here to tell you is that there are like 3 errors in those propositions I just gave you, which are, the US spends more than any other country, and 2, we don't get as much. And so what I want to do now is go through some of those errors. The first thing is never let them confuse you about the difference between expenditures and cost. And almost everybody in the public arena who talks about healthcare here we go. The next one is showing you this diagram. This is OECD, shows the percentage of GDP spent on healthcare in various countries. Okay, US is obviously the top line. My question is, what do you care how much GDP I decide to spend on healthcare? It's none of your business. If I decided to go for the CAT scan to see if I had head cancer, it's none of your business. I'm paying for it. If I have private insurance, it's none of your business. If I'm on a government program, different issue. But if it's private care, suppose I want to spend all my income on health care and not go to the movies. Fine. So percentage of GDP spent on health care really says nothing about anything. What matters is costs. And cost is the resource that you give up to do something. In the U.S., we tend to be a fairly efficiently run healthcare system when you compare it to other countries. If you talk about things like number of physicians per capita, number of hospital beds per capita, number of hospitals per capita, number of visits to the doctor per capita, we have less of those than all of the other OECD countries. There are also a lot of measurement issues here that are a big problem. For example, where do you think they get the national health care spending from? They get it from governments. Now, we don't even think about this stuff. This is why I'm a data geek and I do this kind of stuff. I don't know, well, it's mostly because of John. It's almost maybe we shouldn't raise his salary after all. The data geek. How do you know the accounting systems are the same? And the answer is that the accounting systems are not the same.